So I want to tell you about a patient of mine. Let's call him John. He likes to read, he's retired, he recently got into gardening, and more than that, he's a grandpa. He loves spending time with his family, playing around with the grandkids. He just likes to care for others. That's who he's always been. And so when he noticed a new cough and some difficulty breathing that just wouldn't go away, and unfortunately got a diagnosis of lung cancer, his whole world changed. It was overwhelming. It was stressful, to say the least. When he started working with the doctors here at the James Cancer Center, he knew that he was getting the best care for his cancer. And more than that, we wanted to make sure that John had a good quality of life. Because for John, his quality of life really took a hit with his diagnosis of lung cancer. Something as simple as bringing in the groceries, he felt like he couldn't do anymore, because it just made him feel so short of breath, where he noticed that tightness building around his chest. He was gasping for air. His anxiety was running wild because he wasn't sure if he was getting enough air. He might have thought that something terrible was going to happen. And so even though John got through this experience, he felt really limited. He felt like he just couldn't do the things that he'd like to do or that he used to do without a second thought before his lung cancer diagnosis. And who could blame John? Because his breathlessness felt like if you're underwater and you need another breath of air, but you just can't get it because you're too far away from the surface and you just don't know what to do. And so this shortness of breath is what I want to focus on. Because unfortunately, that's the reality of so many patients with lung cancers. Because it's so common in these patients. About 80% of patients experience breathlessness by a time of diagnosis. And even with cancer treatment, their breathlessness can either remain unchanged or even worsen. And we know it can be really burdensome for patients because it can really impact patients' quality of life and be a common reason why they show up to the emergency room. And finally, unfortunately, there's very limited treatment options for shortness of breath itself. And outside of treating the underlying disease thought to be causing the shortness of breath, or medications with a lot of side effects of long-term use, like opioids. And so when we think about the causes of shortness of breath, we know that physical changes to the lung can contribute. Things like a tumor pressing against the lungs. But we also know a lot of normal experiences that we have every day can contribute. Things like exercise, stress, changes in your altitude can contribute to breathlessness. Things that might be a little bit more within our direct control. And so knowing this, my research is meant to help patients improve their breathlessness and hopefully their quality of life. And we think we can do just that by focusing on the things that contribute to breathlessness that are more in the direct control of patients. And we think those three things that might be helpful is training patients in their pace, their stress, and their meaning behind their breathlessness. So for pace, not only are we talking about the pace of activity, potentially breaking larger activities into smaller, more manageable ones, but we're also talking about the pace of breath. Because we know hyperventilating is just not an efficient way to breathe. Instead, if we can help patients slow down their breath by breathing in through the nose, out through the mouth, in, out, that hopefully we can have them recover from their breathlessness a little bit quicker. For stress, we know that muscle tension can build up a lot when someone feels short of breath. And more than that, that tension can actually make that breathlessness feel even worse. So if we're able to teach patients different ways to relax that muscle tension, not only can we help patients relieve the stress that they feel day to day, but hopefully help prevent worse shortness of breath down the line. For meaning, we think it's helpful for patients to understand more of what it means when they do feel short of breath. Because oftentimes, patients might have these really catastrophic thoughts that might be going around their head when they feel breathless. Thoughts like, I'm not getting enough oxygen, I'm gonna pass out. And instead, we want them to become more of an expert of their breathlessness. And one way to do that is actually putting patients into controlled situations where they feel short of breath. So that might be encouraging them to be more physically active, to walk, to take the stairs, to bring about that breathlessness. And we think it can be helpful because it can better help patients emotionally process some of these experiences about breathlessness. And also, it gives them answers to common questions and worries about their breathlessness. And we can do that by having them monitor their shortness of breath, as well as their oxygen and heart rate during these exercises. And we call this training through one's shortness of breath. And we think this is helpful not only because we're encouraging physical activity to get patients a little bit stronger, but we're also empowering patients with the knowledge to know what to expect when they feel short of breath and know what to do about it. And so again, we think by focusing on patients' pace, stress, and the meaning behind their shortness of breath, we can help them. And so what we did is we took these treatment components and packaged them into a 5-week program that we called Take a Breath, or TAB. And we wanted to see if TAB was helpful in improving patients' breathlessness as well as their quality of life. We're currently collecting data right now, but these results look promising so far. So what we did is we randomized patients to receive either the TAB program, depicted in blue, or the standard of care arm for shortness of breath, depicted in gray. And we asked patients how breathless they felt in the beginning, and you can see that everyone felt really breathless. And here, the higher the number, the more breathlessness there is. But 1 month later, those that completed the TAB program saw about a 50% decrease in their breathlessness, where those patients that had the standard of care didn't really have much change with their shortness of breath. And similarly, we see a result like that with anxiety-related shortness of breath, where we see a big decrease in this anxiety in those that were assigned to Take a Breath program. And not only that, we also see an increase in patients' health-related quality of life at the end of treatment for those that completed the TAB program. So my research aims to equip patients with the skills to better manage their shortness of breath. So I hope that not only are we improving and extending patients' lives with newer cancer treatments, but we're also giving them that quality of life. A life where they can breathe better again and get back to the things that make life worth living. Thank you.